So in the next question, a 28-year-old female who has inserted a copper T 2 years back, she tells you that copper T threads are not seen. Okay, so copper T threads are not seen. What are we dealing with? This is a case of missing IUD. Missing IUD, what is the initial investigation or investigation of choice that you will do? It is ultrasound. Which ultrasound? It is TVS. TVS can tell you three things. TVS, ultrasound can tell you whether. So if they ask you, this question it has already given. If they ask you such a scenario, stop till here and ask you what is the investigation or what is the next investigation that you will do? What is the investigation of choice that you will do? Your answer is TVS. So that part is already given in the question. Now, what is the method of removal if you see in the ultrasound that copper T has gone into the abdominal cavity? If it has gone into the abdominal cavity, initially we put a small scope, that is laparoscope, and you look for it for removal. If that's not possible, then you go for an open surgery, that is laparotomy. So what will you do here? You're going to initially perform a laparoscopy. Laparoscopy is the initial management that you're going to do when you see that copper T has perforated and reached the abdominal cavity. Yes, few key points that you have to note for IUCD insertion. IUCD, again, in the postpartum period, we usually insert it within 48 hours. So when do you go for postpartum insertion? Postpartum, we insert it within 48 hours. If you did not insert within 48 hours, then when can you insert? After 6 weeks. This is known as interval insertion. So ideal is within 48 hours. If it's not inserted, then you can insert after 6 weeks. In the between time, you will not insert. That is between 48 hours to 6 weeks, you will not put any intrauterine devices as such. Usually when you are inserting for a woman who is not pregnant, in a non-pregnant state, when do you insert? In the post-menstrual period, between day 6 to day 10. This is inserted between day 6 to day 10 in non-pregnant state. In non-pregnant women. Day 6 to day 10 in a non-pregnant state. We have another scenario apart from this missing IUD. A woman has IUD and she has become pregnant. That's the other special scenario you get. IUCD with pregnancy. What do you do? If IUCD is there and the patient became pregnant, you can see the thread, means just remove the IUCD. If you can't see the thread and patient wants to continue the pregnancy with IUCD in situ. Common scenario that comes is patient became pregnant now, she wants to continue, you can see the thread. What will you do? If you see the thread, you have to remove it. Remove the IUCD and you continue with the